In Health Matters today, the weight loss drug Wegovy is going to be available to patients in Canada beginning today. Joining us now with more is Dr. Akshay Jain with Obesity Canada. Good morning to you and thanks so much for being with us.
Good morning. Thank you for having me.
All right, so I know that this drug has been available in the U.S. for quite some time. It comes from the makers of Ozempic. How similar is it to that drug?
The actual molecule, semaglutide, is exactly the same. It was originally developed as a diabetes medication for type 2 diabetes under the trade name Ozempic. And then studies showed that this is extremely helpful for weight loss, even in people living without diabetes, those who are battling obesity and overweight. And that's how it underwent a new indication, new trade name called Wegovy. It was approved by Health Canada about 2.5 years ago, but it's only now that we have finally been able to see it come to the Canadian market.
So is it the same formulation as Ozempic or is it slightly different?
The formulation is the same, the dosage is different. So for diabetes management, Ozempic is in 0.5, 1.0, and 2.0 milligram, whereas for obesity management, the full dose is 2.4 milligrams, so slightly higher dose strength there.
All right. Now, whenever you hear the terms weight loss drug, it perks up a lot of interest from people. But give us an understanding of who this drug is targeted towards and who should be taking it.
Absolutely. So as per the product monograph, Health Canada has approved the medication for anyone living with obesity that's a BMI or body mass index greater than 30, or if they have a BMI more than 27, but they have some medical condition arising because of their increased adipose tissue or increased weight. And that could be things like diabetes, high blood pressure, cholesterol problems, sleep apnea, polycystic ovarian syndrome, so a whole slew of different things.
All right. And what kind of side effects are there that come with this drug? Because we've all heard of, how Ozempic can have some pretty strong side effects for some of the users.
So the side effect profile is very similar for all medications in this class of medications, and that's predominantly gastrointestinal side effects. So common side effects can include nausea, and sometimes constipation, diarrhea, or vomiting. The good thing, though, is that these side effects are not that frequent. So in studies, it's about 15 to 20% of individuals on the medication would develop these side effects. And these are mild, and they tend to be transient. So the longer you stick out with the medication, the less the chances that these side effects would be persistent.
And, just overall, from, the point of looking at obesity rates in Canada, how important do you think this drug will be in the treatment of obesity and diseases that are associated with it?
We've been battling obesity for so long now with very little in our arsenal. This drug marks a paradigm change in the efficacy of available treatment options. So up until now, we had medications that were barely scratching at the surface. But now this medication shows that there could be a 16 to 18% weight loss in individuals living with obesity. That's monumental. And for those who have type 2 diabetes and have obesity, the weight loss can be around 10 to 12%, which is, again, quite significant.
Do you have any concerns that this drug could be abused or used by people who aren't considered obese and maybe just want to use it as a diet drug?
Yeah, so that's always a concern. Some people could be using it for purely aesthetic reasons, and I would certainly encourage not using the medication when there is no need for it. The current monograph gives us indication as per the body mass index. But having said that, there are some people who may have a slightly lower BMI, but may still have complications arising due to their body weight, especially people of different ethnicities, First Nations. They tend to have higher risk of obesity-related complications, even at a relatively lower body mass index.
All right. Certainly is interesting. We'll see how it unfolds. Of course, that drug available now to Canadians. Dr. Jain, thank you so much for joining us.
Thank you for having me.